el otro día no había una, hoy en día hay 5, por la cuenta que están cogiendo. So, no se sabe si eso está al día. Lo que sí sabemos es, por falta de pruebas desde el principio, nos permite saber que esa gente que lo mandaron a la casa sin tener la prueba, están transmitiendo el virus casa por casa en nuestra comunidad. Debido a eso, los profesionales de la salud pública creen que tenemos una comunidad grande afectada aquí en la ciudad de Lawrence. Y yo lo creo. Por lo tanto, debe tratar a todas las personas con las cuales tú entras en contacto como si ellos están infectados. Pero, sin embargo, nosotros podemos evitar que los casos sigan creciendo aquí en la ciudad de Lawrence. Primero que nada, quedándose en su casa. Menos que necesita alimentos, medicamentos o atención médica. Las empresas que venden alimentos o medicamentos van a estar abiertas. Y siempre lávense la mano. Y otra vez, quédense en su casa. Si ha perdido su trabajo o ha cerrado su negocio, regístrese para recibir beneficios de desempleo al 877-626-6800. 877-626-6800. Hablé con la congresista Trejan y ella me dijo que el gobierno federal pondrá en marcha ambos programas para dar dinero a las personas que no tienen trabajo y a los negocios que han cerrado debido al coronavirus. Las rentas y las hipotecas. El presidente de los Estados Unidos, la Corte del Estado de Massachusetts y antes de eso el gobierno de la ciudad de Lawrence, hemos todos pedido que se detengan los desalojos y las ejecuciones de hipotecarias. Que detengan los desalojos y también no tener problemas con las hipotecas. Debe, todavía, si tiene dinero, debe pagar su renta y su hipoteca, a menos que su landlord o su banco le han hayan otorgado un periodo de gracia para no pagar. Sin embargo, el primero del mes llega. Una cosa que puede hacer en este momento, si ha sufrido un impacto financiero y va a tener problemas pagando tus biles, es llamar a todas las personas que tú le tienes deuda y solicitar diferir su pago de abril. El bill de teléfono, hipoteca, tarjeta de crédito, el préstamo estudiantil, muchos lo están haciendo, pero tú tienes que llamar y preguntar que te den el diferir el mes de abril. Pero pague su renta y comunícase con su landlord y su banco, si no va a poder tener ese problema. La escuela pública, como se anunció ayer, va a estar dando tecnología para cada familia para tener la educación de los estudiantes de la ciudad de Lawrence. Bueno, eso es un laptop o una iPad para cada familia. La superintendente Paris nos ayudó con eso, asegurar que cada familia tenga uno. Hay una lista de tiempo que pueden ir cuando vayan ahí a comer su almuerzo, pueden recoger su pedazo de tecnología y son usados, pero es para ustedes quedarse con ellos para siempre. Por último, llame o envíen un mensaje de texto a sus familias y amigos, específicamente ellos de mayor de edad, para asegurarle que estén bien. Use la tecnología para comunicarse lo mejor que pueda, porque se tiene que quedar en su casa. Asegúrese con esa persona que ellos sepan que ellos no están solos. En estos tiempos eso es bien importante. Y para información continua y preguntas pueden marcar el número de teléfono del Estado 211 o visitar citylawrence.com. Recuérdense que estamos juntos en esto. Pero también vamos a pasar por esto y vamos a estar bien en el otro lado, como lo hicimos con la crisis del gas. Somos Lawrence y somos fuertes. Así que cuídense, manténganse en la calma y quédense en su casa. Yo hablé mucho y disculpa, I talk a lot, but I apologize. I want to make sure I get the full message out. I did say that the issue of not having, not really knowing the total numbers of people who are affected. Just a day ago, we were at 1. Today, we're at 5. There was conflicting information of what hospitals knew and what the state knew. So forget about what the number is. It doesn't matter. Stay home. And treat people that you come in contact with as if they might have the virus. Next up, I want to have the doctor, Haddad, from Lawrence General Hospital, come and speak. Dr. Haddad?
Good day, everyone. I'm Dr. Eduardo Haddad. I'm a nephrologist. I'm a practicing physician in this community. I'm Chief of Medical Affairs at Lawrence General Hospital. I'm speaking for myself as a physician and also as a hospital representative. If you haven't noticed, I have a mask. The message to you is clear today. We as healthcare workers are taking this very seriously. We know that we can get sick just by talking to people in the hospital, and therefore you can get sick as well by just having social contact in the community. We want to preserve our health as healthcare providers because the work that we're doing right now is critical, not only in terms of diagnosing this illness, but also in treating the ones that are getting sick, which is truly our primary mission. This hospital has a mission of serving this community. We are doing so full blast. We are at every level of this epidemic. We have started by providing testing in different forms to attend to the community need. We were limited by the availability of testing, as everybody else has been in this country. Therefore, the first phase of this epidemic was essentially missed. This is why we find ourselves now in this predicament where we have to tell everyone to stay home because we just don't know what the prevalence of the virus is in the community. The virus is certainly easily transmissible. It is similar to a cold virus. However, because it is a new virus, we do not have immunity. The manner where you're going to respond to this infection is therefore unpredictable. And this is what causes all of the difficulty. You can go from minimal symptoms to a fulminant disease, which all of a sudden makes you very short of breath, and you now need a respirator. And the dilemma of most of these hospitals, including this one, as well as Holy Family, who is our neighbor, is to be able to provide for the possible onslaught of patients that require respiratory support. The need is to reduce the instance of infection in the community as a way of protecting the ones that will end up with this complication. And it isn't just the elderly. It's also the young, the very young, the younger than 1, and the individuals that have chronic lung disease, such as bad asthma and chronic obstructive lung disease. All of these folks are at very serious risk of a fulminant illness. So we have to think of them when we try to prevent social contact to the most we can, understanding that this is a big sacrifice. So I want to assure you that we are here for you. The hospital has made plans to accommodate very sick patients. We have stopped doing elective procedures. We have reserved wards to accommodate patients that might need respirators. We have the operating room, which is newly built, that has large capacity that we can use for this. And hopefully we're not going to need to use it. But this all depends on how the virus is transmitted in this area. We are just at the beginning of this in this region, and we have to learn from history from other parts of the world and other parts of the United States. So it is critical that you do stay home, that you avoid close social contact, and if you have to have close contact with someone you don't know, you should be wearing a mask, just like this one, which protects your nose and mouth. The eyepiece is not needed for regular community members, but just a surgical mask like this is all you need to wear. I've been asked to give the same message in Spanish, so if you want to allot me the time to do that, I will. Mis queridos amigos de la ciudad de Lawrence, lo conozco como ciudadanos, pero también como pacientes. Muchos saben quién yo soy y lo trato a muchos miembros de tus familias. Usted sabe que eso es una enfermedad muy seria. A veces usted escucha que eso es no más que un resfriado, pero no, eso no es verdad. Lo resfriado es un virus que estamos acostumbrados a tener y no causa serias complicaciones, pero eso es un virus nuevo. Es por la misma familia, pero tu cuerpo no lo conoce. El sistema inmunológico requiere una exposición a una infección para que aprenda a fabricar anticuerpos. Eso no lo hace inmediatamente. Hasta que hay anticuerpos en su organismo, requiere pelo menos un mes. Durante la fase aguda de la enfermedad, no tienes protección ninguna. Eso puede causar serias complicaciones de insuficiencia de respiración, para que no pueda oxigenar tu sangre y que va a necesitar una ayuda de un respirador. Eso es una cosa que a veces provoca la muerte. Infelizmente, por todo el mundo está se pasando así. Por muchos países, las personas no prestan atención como deben a este riesgo y continúan a salir a hacer cosas sociales, y usted ve cuando procure por el mundo la incidencia de muertes más grandes, es donde son estas regiones donde las personas no prestaron atención. Aquí en los Estados Unidos, usted ve cómo está la situación en Manhattan, en Bronx, en Brooklyn, que son áreas de gran densidad de poblaciones que están con contacto muy cercano. Esto es la transmisión de este virus, que muchos no saben que tienen, tosen, expira, y usted puede adquirirlo. Es muy importante que se está a la calle, que tenga la máscara como yo, que esa máscara amarilla, que es una máscara cirúrgica para proteger el nariz y la boca. Muy importante que evite cuidados sociales demasiados y que preste atención principalmente a los familiares ancianos que necesitan ayuda para que se queden a la casa. Yo creo que la población latina naturalmente tiene una tendencia de querer contacto cercano. Eso es una cosa cultural. Y para ustedes es más difícil de bloquear esta voluntad normal, natural de ocurrir, para que se quede más distante. Entonces, procure comportarse más como los americanos ahora, con una cierta distancia, que sería bueno para ustedes. Muchas gracias, estamos aquí para servirlos.
Thank you, doctor. If you missed any of that, just stay home. Si perdiste cualquier punto de eso, te perdiste, no te apures, quédate en tu casa. Eso es lo que tienes que saber. We're going to have Dr. Moyne come up. Doctor is Associate Chief of Emergency Medicine. That's not who's talking. Is it Kate? I think that's talking. Is it? Come on, doctor. Dr. Gorn, the public health doctor, has joined us as well. Dr. Moyne?
Good afternoon. I'm Dr. Moyne. I'm an emergency physician and also the associate chief of the emergency room at Lawrence General Hospital. First off, I do want to echo the mayor's comments and Dr. Haddad's comments. Please stay at home. We can't emphasize this more. Please stay at home. Practice good social distancing. Wash your hands. Cover your mouth. And stay away from anyone that could be sick. We need to fight this pandemic together as a community, and this is the best way we will be able to do so. So stay at home. Only go out if you necessarily need to, just like the mayor mentioned, and practice good hygiene. This is how we are going to stop the spread of this disease as a community together. I was asked to go over the symptoms of the disease, and as Dr. Haddad mentioned, the symptoms are varying. It could be just like any other viral illness or cold that you have experienced. You could have a runny nose, you could have a blocked nose, you could have some congestion around your face, you could have a sore throat. The most common symptoms, however, are a fever and a cough, and sometimes feeling like you're very tired or having muscle aches. If you have these symptoms, please stay home. We have developed a hotline at Lawrence General Hospital that will help everyone and guide them through the process of what to do if you do feel sick or if you have any questions around this disease. We want people to use this hotline and stay at home so that we can help them and help them identify if they need to be somewhere else. This hotline is open 24/7 for the community for this resource and will help us fight this pandemic together so that we can help avoid getting everyone ill. It is very important that we continue to stay at home, and I want everyone in the community to be aware that this hotline is available for them. I'm going to tell you the number. The number is 978-946-8409. That's 978-946-8409. If you have any questions around this disease, have any concerns about symptoms that you may be experiencing, please reach out to the hotline. They are available for the community for this specific reason, and we want to keep you at home and have the ability to help you at the same time. Thank you. That is the number, Mayor. Yep.
Otra vez, puntos bien importantes, pero si no oíste nada de eso, quédate en tu casa. Again, very important points, but if you missed any of them or you got lost, just stay home. But the phone number to call is 978-946-8409. In Spanish, 978-946-8409. Eso es el número. Si tú crees que tú tienes un problema o crees que tienes el virus, llama y ellos te van a hacer una cuanta informaciones, una cuanta preguntas, a verificar si tú lo necesitas. Llama el número 978-946-8409. Y si llama y que sigue llamando, te van a recibir las cosas. Pero más que nada, quédate en tu casa. But again, if you call, I'm sure that they'll take care of you, but nothing else, just stay home. Dr. Moyne just spoke. Dr. Goodman from the Holy Family Hospital, if you can come up.
Thank you, Mayor, and thank you for bringing together healthcare leaders and leaders of our first responders. It's very important that you're conducting this event, and I appreciate having Holy Family be part of it so we can drive home the message that everybody should be staying at home, keeping their distance, and protecting one another. My name is Bill Goodman. I'm a pulmonary and critical care physician and the Chief Medical Officer and Vice President of Medical Affairs at Holy Family. Since the beginning of this pandemic, it's been all hands on deck at Holy Family, and I know I speak for others, including Christine Basil. Christine is our Chief Nursing Officer. We're so proud of our staff, our nurses and doctors who have been working tirelessly in overtime, taking care of patients in the hospital, managing outpatients, so that members of our community can be at home, practicing social distance, as you've heard, keeping 6 feet away from one another, protecting their family and loved ones, and only going out for essential business, such as going to the pharmacy or getting food. I've been asked to comment and report on the drive-up testing access point we've set up in Haverhill. It's a drive-up location for folks to get tested if it's indicated. In the Haverhill parking lot of our Holy Family Hospital, there's a tent and cones and signage to direct patients who have received a doctor or a provider's order for a test. Now, those who are listening to this message and have now become aware of this testing location, the first and most important thing is to call your primary care provider. testing is not for everybody. Resources for testing are limited. For example, the swabs, most of them, believe it or not, have been made in Italy in the past, where they're in short supply. Transport media for the swab itself is in short supply. We don't want to have folks tested that it will not impact their management. So if your provider feels it's important, you'll get an order and you can go to the tent. You'll drive up, you'll stay in your vehicle, and a healthcare professional will swab the back of your nose. The test result will be reported to the individual who ordered the test, and the hours of operation are weekdays only, 9 to 5. At this point, we've, in total, at Holy Family, we've sent out about 700 tests. About 500 of those have been from the tent, and approximately 10% have been positive. We've only had a return of approximately 400 test results, and 36 have been positive thus far. We know there's far more disease and infected folks in the community, so it's best practice to consider one another being infected, and it's important to keep your distance from each other. So with that, thank you very much, and stay home.
El doctor habló de la manera que los pruebas se están haciendo y tienen diferentes lugares donde lo están haciendo. Habló de los diferentes lugares, pero tú no vas a poder ir nada más con el carro o a caminar a la puerta y buscarle una prueba. Vas a tener que tener algo de tu doctor primario. So, si tienes esa necesidad, llama al número que di antes y busca la prueba por tu doctor. Pero quédate en tu casa. Realmente no hay necesidad de salir para afuera. Si tú no lo tienes, quédate en tu casa. Y si tú no tienes una cosa de tu doctor, no vas a poder coger un examen. So quédate en tu casa. So again, same verse, same as the first. That was really good information, but just stay home. There's really no need. Call your doctor if you need to get tested. Dr. Kelly from the Great Lawrence Family Health Center, if she can come up and speak. Where's Dr. Kelly? Is she here? Oh, there she is. Come on.
Hi, everyone, on this great sunny day with a little bit of snow. Thanks so much for allowing us to talk to you about the coronavirus in our community. One of the things that I'd like to share that I think is really important is at the Greater Lawrence Family Health Center, where I'm the Chief Medical Officer, we have seen many patients coming in with respiratory illness. Initially last week, we were not able to test them because testing was not available. Late last week, we did start testing a number of patients, but at that time, the laboratory we were sending to, because there was not one available locally, was across the country, and it has taken 5 to 6 days to get those results back. So as you can imagine, a lot of the results are only coming back now for a lot of people that were tested. At the end of last week, we started using another more local laboratory, so we're starting to get some tests within 24 to 48 hours. Some of those tests came back first prior to the ones that were sent across the country. So just to give you an idea of why we are not seeing as many positive tests coming in is that the testing initially was not available. Then it was taking a lot of time for the test to be run. And now we are going to start seeing a lot more of the test results coming back. So given that we have seen so many patients in the health center with respiratory illnesses that are consistent with coronavirus, we as a healthcare group believe that there is a lot of coronavirus, a lot of people who probably have coronavirus walking around in the community right now. Some people are not going to be very ill. It may seem like they just have a cold. Some people will not get ill or very ill until they've had it for a week. So some of the what has been seen in other countries is that initially someone will be slightly ill and then they will become very ill after a week has passed. So especially those who are older and have chronic medical conditions, it's very important if they contact by phone, so don't come into clinic sites, but contact by phone so that we can do a visit with you over the phone and help determine if you require testing or not. So not everybody is going to be tested, as has been said, because the supply of those tests is low. So we are going to be prioritizing who really needs testing. So in other words, people who are at high risk of becoming very seriously ill. So what can you in the community do? There is so much that you can do to help decrease your risk and your loved one's risk. So number one thing has been said many times is social distancing, or stay at home. Social distancing means 6 feet apart. So that means that if you are standing that far apart, you are unlikely to be in contact with any of the particles that come out of one person's mouth, nose, sneezing, coughing. So that's why the 6 feet is very important. So another thing that's very important that's been said is washing your hands. Wash your hands with soap and water for 20 seconds to make sure that you have gotten them cleaned. Try not to touch your eyes, nose, and mouth. When you get particles on your hand and then you touch your eyes, nose, and mouth, that's how it gets into your body, is by touching those surfaces on your face. Another thing that's really important is to make sure that you stay socially connected and healthy yourself. So eat well, fruits and vegetables, and make sure that you are staying connected. Like Mayor Rivera was saying, it's really important. Use those social media apps, call your loved ones, and make sure that you're staying connected so that you remain healthy and have the ability to, even though you're staying at home, continue to feel emotionally well as well. So I just want to communicate that we can do this together. These are things that may not feel comfortable to do, but you can do them. It's not easy to not give people hugs and kisses, but this is something that's going to help get us through this coronavirus period. So please keep your distance from people, follow all the recommendations, stay home, and we can do this together. Thank you very much.
La doctora estaba hablando de las cosas que pueden hacer para protegerse. Primero que nada, quedarse en la casa, pero lavarse la mano con agua y jabón a lo menos de 20 segundos. Evitar tocar los ojos, la nariz, la boca con las manos sin lavarse la mano. Cubrirse la boca cuando estornuda o tose. Pero primero que más que nada, si no permite, quédese en su casa. Just stay home. I think that all this information is really good, but the best thing you can do is just stay home. Up next, the President and CEO of Rueda Lawrence Family Health Center with some updates from the health center. John Silva.
Hello, greetings from Greater Lawrence Family Health Center. I'll make this short and very sweet. The first message you haven't heard yet today, stay at home. Stay at home. If you feel sick, stay at home. If you're unsure, stay at home. Greater Lawrence Family Health Center has been at the front line of this crisis since it began, even before people knew it was beginning. Right now we've consolidated all of our health center locations throughout Lawrence and Methuen to 2 locations. The first one is at 34 Haverhill Street, which is right down the street from Lawrence General. The other one is 150 Park Street. We call it our North Health Center. They are open, and they are open regular hours. You can log on to glfhc.org at any time. You can get the latest update related to when those sites are open, when our pharmacy is open. Our pharmacy, by the way, is open at every one of our sites. I believe only the West Health Center has closed their pharmacy. We do telehealth. We do telephone appointments. You can call us and schedule an appointment. You can call us and we will have an appointment with you. We have clinicians that are doing nothing simply because they may be at high risk, be in that age group, at high risk of contracting the coronavirus. They are on the phones. We have infection control teams at our health centers that are open for hours every day. We want to see the sickest. If you call us, we will tell you what you need to do. If we ask you to come in, please come in. It means your symptoms may have worsened. If we tell you to stay home, it's not because we don't love you, it's because there's nothing that we can do for you at that time. If you stay home, and everybody stays home, then this crisis will pass in 4 to 5 weeks. So that's the message from Greater Lawrence. Thank you, Mayor, for putting this together.
You leave that piece of paper here?
Yeah.
Is it in Spanish?
No, well, it's just the
The locations, right? Yeah. La cosa importante del Centro de Salud de Greater Lawrence Family Health Center es que nada más tienen 2 locales que están abiertos, la 34 de la Hebro, que está aquí al lado del Hospital General, y 150 de la Park Street, que está ahí con cruza la Park y la Lawrence. Esos 2 lugares, también si tú tienes que ir a la farmacia de Greater Lawrence Family Health Center, todas las farmacias están abiertas a buscar tu medicamento. Pero si no entendiste nada de eso, quédate en tu casa. Again, second verse same as the first. If you miss something, you can go online, you can find all this stuff out, but just stay home. Don't come out. Next up, to talk about inspectional services, the businesses, and what we've done around licensing is our Commissioner of Inspectional Services, Mike Armano.
Thank you, Mayor. Good afternoon, everyone. Again, Mike Amano from Inspectional Services. So right now, Inspectional Services is working under the guidance of the Board of Health through Dr. Joel Gorn and Stephen Gill. Our public health nurse, Jackie Aguilar, she's very busy. She's working hard. She's doing contact investigations of any activity that we see in the city of Lawrence. We're very grateful also to have some assistance from our public school nurses who also will be helping Jackie in the near future. Our inspectors in inspectional services are also working hard in the streets right now, and they're spreading the message, of course, to not only stay home, but for people to realize that this is a community-driven response, and I think that's the most important thing. It's community-driven, and it's time for the community to take ownership and make sure that if you're a small business owner that can avoid opening your business, close the doors, send your employees home, and tell them to stay home. To make sure that we have compliance with some of the governor's orders and some other things that are happening coming from the local government, our inspectors are going to be going door to door. They're staying, maintaining social distances, and they're spreading that education. The response, of course, is to stay home, but we want to make sure that you do check in with your family and friends. From a public health perspective, if you're feeling sick, if you've recently had contact with someone, family and friends, then the right thing to do would be to call them up, tell them that you're feeling ill, and make sure that they know that you might have had something that you spread to them. If you're planning on having private gatherings, we get a lot of phone calls about private gatherings and what can I do? Cancel your gatherings. It's not the time to be gathering in any way, shape, or form, irregardless of the number. If you're living in a multifamily home, you might have a common hallway, you might have a gathering spot in that building. The advice is to stay out of those common hallways. Don't socially gather. Again, connect with people by phone, connect with people by email, connect with people any way but person to person. Lastly, of course, it's been mentioned already, but if you're sick, telephone your primary caregiver, get direction from them. If it's an emergency, of course, call 911. We're encouraging people right now to call, use the Mass 211 system. If you're looking for information, go to mass.gov. Get some consistent, real information using those websites and those resources. If you have specific questions, whether it be about licensing or permitting or what you should be doing, you're more than welcome to contact Inspectional Services. We may not get to you immediately. It may go to our email, but we will get to you within the hour. So you can contact 978-620-3130. That's the local number. If you can't find what you're looking for on mass.gov or by Mass 211, again, the number for Inspectional Services Mass is 978-620-3130. 888-888-3030, and we will get back to you. We're answering emails, we're answering phone calls. Thank you so much.
La cosa importante que habló sobre de los negocios, si tú tienes un negocio que puede estar cerrado, que lo cierre la puerta. Y esos son negocios que no tienen que ver con medicina, medicamentos, con comida. Bodegas pueden estar abiertas, pueden también vender comida, pero tiene que ser para llevar. No puede comer en lugares. Eso es una de las pruebas que están mucho tiempo. Si está haciendo construcción en la ciudad de Lawrence, tiene que parar de hacer eso. Si vive en lugares que son una cuanta, 3 o 4 apartamentos en un lugar, tiene que asegurar que no se pasa mucho tiempo en los pasillos o venir más de 10 personas juntos, pero si van a estar juntos, que lo vean de 6 pies a distancia. Si iba a hacer una fiesta, iba a hacer una reunión con mucha gente, deje de hacer eso, quédese en su casa y realmente no haga eso. Si tiene preguntas sobre licencias o los permisos de la ciudad, pueden llamar 978-620-3130. Eso es 978-620-3130. 3130. Y eso es para cualquier negocio que tenga cualquier pregunta sobre licencia o cualquier pregunta sobre un permiso. Pero realmente, si tú no estás vendiendo comida, si no estás vendiendo comida cocinada o no está cocinada, si no una bodega, una farmacia, realmente debes cerrar tu negocio. Y como dije al principio, va a tener los programas del Estado, el gobierno federal y estatal, van a hacer un proceso para ayudar esos negocios en el futuro. Hoy no es tiempo para preocuparse del dinero, hoy es tiempo para preocuparse por la vida de las personas. Y si no entendiste nada de esto, quédate en tu casa. If you don't understand any of it, second verse same as the first. Just stay home. You can't get anybody. Just close your business and stay home. That's the best thing you can do right now. Next up, Martha Velez, our Health and Human Services Director.
Yeah. Good afternoon. First, I want to say thank you to first responders we all have families and this is a scary time for all of us. They're working through this crisis and our team has been hard at work educating and outreaching to this community. Since March 10th or so, we started doing our outreach where we put out 20,000 flyers letting people know how to protect themselves. We did it through elderly housings, we did it at Adult Day Healths, we did it at Lawrence Housing Authority, every single door to door. We did it at churches, we delivered them to businesses. We did it at the school lunches, grab and go bags. We put it on the buses, we gave it to the taxi drivers. Our goal was to educate community on how you could prevent catching coronavirus. What we are doing now is bringing community together to try and see what's our next step and what do we need to do to come together to, as a community, solve this and go through it. Once again, a crisis that Merrimack Valley has to go through. We've been working with Elder Services and the Boston Food Bank. We continue to deliver Meals on Wheels because we want to make sure that our elders are eating. And if anybody needs a meal, we will make sure that they get one. We have different protocols for how they're delivering meals. We have different protocols on how we're packaging meals. I've been having weekly conference calls with all elderly housing managers to make sure that they know that we're here to support them and if they have a need to let us know. With Groundwork Lawrence and the City of Lawrence, we hosted yesterday a conference call with over 60 nonprofits organizations to talk about food, financial assistance, safety of all our volunteers that we know we're going to need, our soup kitchens, the grab-and-go bags, the food pantries, and what are they doing to make sure that we continue to have that available, and long-term financial assistance, as we know this is going to be a hardship. I started going on the radio this week, and I will continue to go on the radio to continue to educate. Stay home. It's not anymore about prevention. It's about staying home. It's about distancing. We want to make sure that veterans know that we have services for them. If any veteran out there needs assistance, call our Veteran Services Office at 978-620. I want to make sure 3581, 978-620-3581. We also have created a website, We Are Lawrence, which was there, but we're putting all our information in there, wearelawrence.org. In Spanish, somolawrence.org, where you could gather information and resources in this community. Our team at the center are working from home. We are not shut down. Our building shut down, but our empathy and compassion to serve our community continues. We are answering phones from homes. If you are an elder, again, if you are an elder and you are living in the city of Lawrence and have questions or concerns, please call 978-620-3540. Leave a message and we will get back to you. Lawrence, Merrimack Valley, we can beat this as a community if we just stay home. Stay home. You help one another. Muy buenas tardes a la comunidad de Lawrence y al Merrimack Valley. Primero le quiero dar las gracias a todas las personas que están trabajando duro para estar seguros que nosotros tengamos una vida saludable. Ellos también tienen familia. Nosotros hemos estado educando a la comunidad para estar seguros que la comunidad sepa lo que está pasando para prevenir primero el coronavirus. Le dimos más de 20,000 boletos que decían en la ciudad de nosotros en cómo se pueden proteger y lavarse las manos y toser en el hombro, pero ya estamos en un punto donde eso no es lo único que tenemos que hacer, tenemos que quedarnos en la casa, tenemos que hacerlo como una comunidad para poder prevenir lo que está viniendo. Encima de eso se lo dimos a todas las casas de personas mayores, se lo dimos a las iglesias, se lo dimos a los negocios, se lo pasamos a las escuelas cuando están dando los almuerzos, la pusimos en las guaguas, se lo dimos a los taxis. Estoy trabajando con la comunidad que es Elder Services of the Merrimack, que ellos es lo que dan el servicio para personas mayores. Estamos hablando con Boston Food Bank, que trae comida, que es la compra que nosotros damos un viaje al mes para estar seguros que tengamos compra en la comunidad. Estamos cambiando cómo hacemos las cosas. Los voluntarios están llevando comida todos los días y lo que hacemos es que lo dejamos fuera y tenemos que hacer cosas diferentes para poder estar seguros uno con el otro. Yo tengo una llamada toda la semana con las personas que son los agentes de las casas de las personas mayores. Con Groundwork Lawrence y la ciudad de Lawrence, ayer tuvimos una llamada de conferencia con 60 agencias que son non-profit, para discutir la comida, el dinero, cómo los voluntarios se pueden estar seguros, las agencias que están dando comida, cómo se pueden proteger y cómo podemos seguir ayudándole a ustedes cuando todo esto se acabe. Empecé a ir a la radio el sábado y voy a seguir haciéndolo para educar a la comunidad y pedirle a todos ustedes que pongan de su parte y quédense en su casa. Si usted es un veterano y tiene cualquier servicio y necesita cualquier servicio o tiene preguntas, por favor de llamar al 978-620-3581. Si usted quiere coger la información, está en español, somolawrence.org, toda una palabra, Somos Lawrence. El equipo en el centro, ellos están en su casa trabajando. Nosotros tenemos y sabemos que ustedes nos necesitan. Si usted es una persona mayor y necesitas ayuda, por favor llamar al 978-620-3540, deja un mensaje y nosotros lo llamamos. Como siempre, nosotros somos fuertes, nosotros sabemos cómo ser comunidad, nosotros nos podemos parar juntos y como está diciendo el alcalde, por favor, quédense en su casa si no tienen necesidad de salir. Los quiero mucho, que Dios los bendiga a todos.
Next up, we want from the mass hires, the people who deal with issues around jobs. Abel Vargas, who's the executive director, is going to talk. But the last thing I just want to say that you've been hearing a lot of websites and phone numbers. Write them all down, and you can get all that information. And especially if you want to, questions around paying bills or taxes or water, all that stuff. Oh, you're going to have a lot of information. You can find that online. To get that information, please do so. The Lawrence City Hall is also closed, but you can find a lot of those services online. But stay home and look it up online. Don't come to City Hall and don't go out. Ha oído muchísimo información de diferentes páginas de la red, a diferentes teléfonos de recursos. Apuntan todo eso, son todo importante. La ciudad la alcaldía está cerrada, pero la ciudad puede ser servicio en la red. pero más que nada, quédese en su casa. Realmente toda información está bueno si lo hace de una distancia. Tú hay mucho la distancia física, la distancia, olvídate de esa palabra, quédese en su casa. Si tiene que buscar comida, vea a comer comida y no se acerque de la gente y trata a la gente como si están infectados. Pero sé que el problema financiero es una cosa bien importante y hablar de lo trabajo y asuntos de trabajo, Abel Vargas, del Departamento de Desempleo.
Good afternoon, and thanks to the mayor for assembling this group and making sure that we're informing the public with as much information that they need to be able to withstand the issues that we're having. As the mayor said, my name is Abel Vargas, and I'm the executive director of the Regional Workforce Board, Mass Hire. And just some quick notes, and consistent with what the mayor was noting, with that stay home theme that we've been hearing. A lot of businesses have been saying and doing the same exact thing. And the result of that stay-home order is that people are losing their jobs, at least temporarily, and people are forced to apply for unemployment benefits. Our career center that we have both in Haverhill and in Lawrence are both closed to the public, but we are still working. We are still providing services to people. And the directive is if you have a need to file for unemployment, the first place to go is to go to mass.gov/DUA. That's the one-stop shop where you can go there and submit for unemployment. The good thing that the state legislation a couple of days ago voted to waive the 1-week waiting period that many of us are familiar with when we're filing for unemployment benefits. That has been waived. So if you apply, you'll be able to get your benefits pretty quickly. And again, that's kudos to the state legislature. If you're not comfortable with going online and want to make a phone call, you could also call the unemployment line at the state level. The phone number is 1-877-626-6800. There you'll find people that can provide you with services in Spanish, English, and a number of other languages for folks that need the support. Our career center, though it's closed, we're still providing services. So if you need help or you need specific questions about the region, you could also call our career center. They may not be able to pick up the call right in that moment because there's a lot of phone calls coming in and limited amount of people taking calls at our career centers, but you can absolutely call if you need local support, and that phone number is 978-722-7000. On our website, the website of the Career Center, Mass Hire, mvcc.org, there's specific instructions on how to file benefits step by step. Those instructions are listed both in Spanish and in English for folks that need it. Como dije en inglés, mi nombre es Abel Vargas y soy el director ejecutivo de la agencia que maneja la oficina de desempleo en Haverhill y en Lawrence. Ahora mismo actualmente la oficina está cerrada, pero aunque esté cerrada todavía estamos dando el servicio a la comunidad. Y si necesita el servicio nos pueden llamar al número 978-722-7000. El lugar principal para someter para beneficios de desempleo sería mass.gov/DUA. Es el mejor sitio para someter para los beneficios. Si no te sientes cómodo con la internet, también puedes llamar al número estatal 1-877-626-6800. De nuevo sabemos que con la orden de quedarse en la casa, muchas compañías están cerrando la puerta y el resultado de eso es que las personas, por lo menos por ahora, han perdido su trabajo. Queremos saber que si tiene la necesidad, puede ir a la información que yo le di. Sabemos mucho de la espera de una semana para recibir beneficios. El gobernador y los legisladores del estado han decidido no tener esa necesidad de esperar una semana. Si quiere aplicar ahora, va a recibir su beneficio mucho más pronto que se ha recibido en el pasado. Muchas gracias.
Otra vez lo que dijo Abel, bien importante, el asunto de buscar ayuda para el trabajo y beneficios, si pierde el trabajo o cierra tu compañía. Llamen eso para aplicar para eso y a la red. El número que yo tengo para eso es 877-626-6800. A eso por teléfono, por la red. No salga de la casa. Realmente, si no entendiste bien lo que dijo Abelito, nada más quédate en tu casa. Again, if you don't understand what we just talked about, you can go on the website, you can find information, but just stay home. Really, at the end of the day, that's the best thing you can do. I know this has been a long conversation. I want to take questions now, but I wanted everybody to have as much information as I have in my head. I wanted you to have it, and I have all these people we've been meeting a lot recently. But if you don't take anything else away from this, just stay home. I'll take whatever questions people have.
Mayor, in Spanish for Telemundo.
Sí, claro.
Usted dijo que hay 5 casos confirmados, no sabía exactamente si habían más o no, pero queremos saber cuál es la condición de estas personas y si dentro de estos 5 casos hay 2 personas que son personas homeless, sin hogar.
Lo que yo quiero comunicar es que el número no importa, que son 5, que son 20, que son 100. Hay tantas personas, no se sabe que tienen el virus, que todo el mundo se tiene que quedar en la casa. No importa las condiciones de la persona, porque lo que importa más que nada es que la comunidad afectada es tan grande y no se sabe cuántas personas realmente estén. El Estado está diciendo 5, pero no se sabe que son 5. Ayer nada más fue 2. Se aparecieron 3 de un minuto al otro. No que hay confusión, es que la manera como lo están contando no es tan organizada. Y más allá, en los principios días de este problema, de esta crisis, no se estaba haciendo pruebas. Y mandaron gente a la casa que lo tiene. Y esa gente está en la casa. Y son gente que no tienen, que no están infectados en una manera que están tan enfermos, pero están poquito enfermos. Por eso el mensaje mío es que no importa realmente cuánto hay y no hay y qué tan afectado esa persona. Lo que importa es que usted la primera cosa que tiene que hacer es quedarse en su casa. Y si tiene que buscar comida o buscar medicamentos, puede hacer eso, pero que lo haga rápidamente. Just so I can say that in English. She asked me about the 5 cases and some information around it. The 5 cases, it doesn't matter. It could be 5, it could be 20, it could be 100. We don't know. And it's not because they're not trying to count. It's just that in the early days of this epidemic, they weren't doing enough testing and the testing in the right manner. So we sent people home who were sick. I say we, but that's the royal we. That's what we were doing. That's not blame. That's just what happened. So because we have no idea of the number of people who have it, and we will not know, you should just stay home. Stay home. And if you need to go out for food or for medicine or for medical attention, you should do that. But you should stay home first and foremost. And if you're getting crazy in your house and you just go walk around your neighborhood, you don't got to go to the White Mountains. You don't got to go to the North Common or the South Common. Just walk around your neighborhood and go back into your house. But you shouldn't be around the people. You shouldn't be around more than 10 people in a row. And you got to do that 6-foot thing. That's why it looks kind of weird out here. And so, la cosa importante es que se tiene que quedar en su casa. Y si se siente medio raro y quiere salir para afuera a caminar en el vecindario tuyo. Tú no tienes que ir al parque, no tienes que ir a un parque afuera de aquí, no tienes que montarte en el carro y salir. Quédate en tu casa, camina en tu alrededor de tu vecindario y entonces cuando acaba, a tu casa. Pero si tienes que buscar comida, tienes que buscar medicina o asunto de medicamento, atención médica, a eso. Pero cuando acabe, vas a tu casa.
Alcalde, usted hablaba, podríamos decir entonces que Lawrence estaría atravesando por una crisis al no conocer exactamente el número de casos. Usted decía también que iban a decretar especie de un toque de queda, pero no lo han dejado. ¿Por qué? ¿Quién no lo deja? ¿Y qué acciones legales usted puede enfrentar por esta situación?
Esta crisis que tenemos en Lawrence lo tiene todo el mundo. Cada ciudad que te dice tenemos 5, no sabe realmente cuánto tienen. Porque le pasó a Lawrence, le pasó a toda la ciudad, al estado entero. Porque en los principios días de esta crisis no estaban haciendo exámenes y mandando gente enferma a su casa. Y esa gente estaban actuando como que no lo tenía. Eso no se sabe realmente. Lo que tú ves ahí es, si lo puedes multiplicar por unos cuantos, tú sabes que hay más personas. Sabiendo eso, le estamos diciendo que se queden en la casa. Yo quiero hacer una toque de queda, pero me están diciendo los abogados de la ciudad y de diferentes niveles, me están diciendo que yo no tengo no tengo realmente el poder para hacerlo. Yo estoy hablando con la fiscal general a ver si me dan ese apoyo para yo hacerlo. Pero no se sabe realmente si yo tengo pero si el momento que me dicen sí lo tengo, yo voy a hacer un toque de queda de noche a día para ayudarle en algo que las personas se queden en la casa, que planifiquen mejor la manera de cómo se mueven en la ciudad. Pero no tengo ese poder ahora. Y estoy llamando sí para que me manden un grupo de Guardia Nacional aquí a la ciudad de Lawrence para ayudar a la policía y los bomberos. So just to say that in English, she asked me about, whether or not I do have the authority to do a curfew, and if not, why and who. And so the basic is that I would love to do a curfew from night to day, from dusk to dawn. I don't have the authority. I'm told I don't have the legal authority to do that. I'm trying to fight that through and work with the Attorney General to make sure that I'm told if I do it and there's and I don't have the support of the legal community, that I might be personally liable for that. And so I'm not trying to lose my life for that. But if I get the okay, we're going to do an overnight curfew, just again to better manage people staying home. But he also asked whether or not this issue about not knowing the number is just specific to Lawrence, and I said no, it's not. I think it's every community who thinks they know how many they actually have in the city. It's a multitude of that number, because in the early stages of this thing, we did not do testing and we sent people home when we're sick. No one can refute that. In every community that happened. And so I'm not sure that it really is known, the whole thing. And I did call the governor and ask for a detachment from the National Guard to come to Lawrence to help the police and to help the fire department.
Alcalde, ¿hay algún plan para ayudar a las personas sin hogar en estos momentos tan difíciles? Y la segunda pregunta, ¿sabes usted si en este hospital hay enfermeras que estén en cuarentena?
Las personas que no tienen que ir, yo creo que hay un esfuerzo en nuestro departamento de comunidad, desarrollo de comunidad, para ayudar a las personas que están viviendo que están en sus casas, que no tienen suficientemente donde ir, cosas así, familias y jóvenes que son homeless en nuestras escuelas. Sí, estamos apoyando ese esfuerzo grandemente. Hay otro grupo de personas realmente que son homeless, que no tienen donde ir, y trabajar con ese equipo bien difícil. Yo creo que ese trabajo es el trabajo del Estado, y hoy en día yo no sé si ellos tienen un programa para eso. Yo de la enfermera voy a dejar a otro que hable, pero yo no sé de la enfermera. So she asked me two questions. The first one is about whether or not we have a plan for the homeless folks. And what I said to him, we're working very hard to make sure that people who are underhoused, who are living 3 and 4 in an apartment, that we can help them find places to live. Children who are homeless in our public school system, to make sure that those folks are up to have a place to go to deal with this situation. But there's a group of people who are homeless in our community for mental health reasons or for addiction reasons that we are just ill-equipped to help. And I think that really is the role of the state. And I don't know if they have a plan. But she also asked a question about nurses, whether or not, what was the question?
Nurses in quarantine.
If there's nurses in quarantine. I'm not sure I don't know if anybody wants to answer that question. The question is whether or not we have nurses in quarantine. And LGH and in Holy Family.
Hi, I'm Kim Moriarty I'm the Director of Emergency Services at Lawrence General Hospital. So we have had a few nurses that have been sent home to self-quarantine while they monitor their symptoms due to exposure. In the beginning of all of the presentations, not all the presentations were the same. So sometimes people came, like Dr. Kelly said, not very sick, came back a few days later very sick. And so that first visit, we missed an opportunity to test them because they didn't fit in the criteria. So there are a few nurses now on home monitoring. They are just monitoring their symptoms. They are not sick.
How many?
4.
Ma'am, can I ask you about, I'm sorry, can I ask you about your PPE situation? Do you have what you need?
So I think right now we have what we need. I think we're like every other hospital in the state of Massachusetts. I just got off a call with DPH earlier, right before this press conference, and every single hospital had the same questions about PPE. So the state of Massachusetts has asked to get some equipment from the national stockpile. That is coming. So we are waiting for that. In the meantime, we are following 100% the CDC guidelines. That is who the authority is right now. We will do what they tell us to do and utilize PPE.
Can we have Holy Family answer the question too?
Christine Basil will answer. How many cases are in the hospital right now?
Can you answer? So let her finish it, then we go to some questions. Go ahead.
Well, we're waiting for her.
You gotta move over. Come on, hold on.
My name's Kim Moriarty, and I am the Senior Director of Emergency Services at Lawrence General Hospital.
Thank you.
Sorry about that.
Sorry about that. Go ahead. I'll wait just in case there's more. Sure.
Hello, Christine Basil, Chief Nurse at Holy Family Hospital. So like everyone else in the community, nurses are members of the community as well. So just as we have members of our community that have traveled recently, possibly been in contact with someone who's sick, not only nurses, but our entire hospital community, we are treating them just the same. So if we have situations which come to our attention where someone has traveled and or been in contact with someone who's been sick, out of an abundance of caution, we are absolutely asking nurses to stay home. We hope that the 2 weeks will pass and that they will come back to us well. But again, it's beyond just nurses, and this is a community thing. And as members of our community, our workforce is as well. So I do just want to highlight that.
Can I ask the question? How many of your staff have been tested?
So whether an individual gets tested or not is actually their public, their health information, and so I wouldn't be able to speak to that.
Just the number of staff
I'm sorry.
in the hospital?
I wouldn't be able to speak to that.
You guys have another question?
Equipment or anything along those lines at this point while you wait for proper PPE to come in? That's hard to say, proper PPE, probably the incorrect terminology. But are you stuck doing anything along those lines, or are you comfortable with what you have right now?
Well, I would say that, no one is comfortable with the unknown ahead of us. But I will say that we are positioned well at Holy Family with the equipment that we have. And we are blessed to be part of a hospital system who is working tirelessly, excuse me, I am a little tired, to be sure that our frontline staff is supported with the appropriate equipment to be used in accordance with CDC guidelines, to be sure that our staff, our most valuable asset, are protected.
Next question about the
They won't say it, but I'll say it. They don't have enough equipment. I think that they have a professional demeanor and posture that I think it's appropriate. But I have not heard one instance that they have that can prepare for what is expected. Do they have what they have today? They might have what they have today. But I'm going to stand here and advocate for the men and women in these hospitals to get as much as you can, as fast as you can to these places, because these are the front lines. After that, if these things fall down, there's no other backup here. It's going to be triage in a MASH unit type of situation, and we don't want that. But you know how we can avoid that? People just stay home. Just stay home. We don't have to worry about any of this if you just stay home. Realmente ella habló de lo diferente.
But do you want to temper that comment? Because I'm sure you don't want to panic people.
Listen, if you are panicked, be panicked. Okay. You can't both be in a state of emergency and a state of normalcy. They're in Congress. You know what I'm saying? That doesn't work. We are in a state of emergency. People should be scared. I'm not saying you should go loot. I'm saying you should stay home. Stay home. Take care of your family. Talk to your people. Make sure everybody's okay. We're going to get through this. But no one should think that this is a normal day in the city of Lawrence or in the state of Massachusetts. We have a national state of emergency and a state of emergency in the Commonwealth. Countries are shutting down. You should be every precaution, and the very first precaution to save you and your family, to make everybody safe, is to stay home. Now, she talked a little bit about, ella habló de lo diferente, la enfermera estaban hablando que tiene suficiente equipo y cosas, y hablaron de la persona, número que estaban ahí. Realmente ellos no tienen suficiente equipo, y tienen que mandar, y si ustedes saben dónde hay equipo, de máscara, de cosas de protección, para ellos y para los bomberos y los policías, a no dejar saber eso, porque se necesitan más y más. Ellos son la última línea. Si los hospitales no están preparados y no están defendidos, realmente al fin del día ellos son la última línea. Después de eso es una situación bien fea. Pero podemos evitar eso haciendo más que nada que se queden en la casa. Okay, I'm sorry. Somebody else?
Yeah. Why did you ask the governor to send the National Guard? I didn't hear the.
Yeah, no, so we are asking to able to enforce the governor's stay-at-home advisory. We've asked for support from the National Guard to do that.
What would they do?
We'd enforce the advisory, right? Because the advisory basically leaves the enforcement of it to the localities. And we're not resourced for that, for all the many things we do. When we have staff going out to tell businesses to shut down, we're trying to figure out a way to do an education piece. You might have gotten this to get in everybody's home, stay at home, with some information on it. But we're not built for this. No, any municipality that tells you they're built for this thing, in the worst case scenario, it's just not truthful. So we're going to need the National Guard to come through. Also, if you see the National Guard on your street, this is a serious thing. I don't think people understand how serious it is. And so we don't only just want the Lawrence Police Department, who you see every day, the Massachusetts State Police, who you see every day. We want to see guys in uniforms, making sure people know they need to stay home.
So you expect armed soldiers to be on the street wandering around the neighborhoods?
I don't run the National Guard, so I don't know if they're going to be armed. But I hope that I will get National Guard folks there.
Last question.
Mr. Mayor, you can't, it's like 1.5 questions. Mr. Mayor, regarding the curfew, just so we all understand, you can't do that because you need a home rule petition, right?
No, I believe it. What I'm getting is that it's against the Constitution of the Commonwealth.
That's what I'm saying. It would have to go to the General Assembly.
No, it would have to actually change the Constitution because it's... it's a constitutional matter. Everyone has the right to move around the Commonwealth without being restricted.
Okay. And this region has taken, over the last year and a half, a major economic hit. It may be too early to ask about this, but what are you telling businesses and people who live here? I mean...
Yeah, it's not too early. And honestly, it's the community, the Lawrence, Andover, North Andover community, we were hit with the gas crisis. And the reality is that it's been really tough to come back from it. And this is going to make it worse. But I got to tell you, we got to worry today about people and tomorrow about dollars. And today you worry about people and tomorrow we'll worry about dollars. Because if we don't worry about the people today, there won't be a business, there won't be a community to go to those businesses. So today we worry about people, stay home, unless you got to go to get some food or to get some medicine, or you need to go to the doctor. Ella me preguntó sobre el asunto de esta comunidad que ya recibe un golpe grande de la crisis con la compañía de gas. Y yo dije sí, que las cosas están mal y se van a peor, pero hoy en día tenemos que preocuparnos de las personas y ahorita del dólar. Hoy la persona y ahorita del dólar. Si podemos evitar que alguien se enferme, se pongan mal y vamos a perder un negocio, es mejor que no perdemos la persona. Pero yo espero que después que esto pase van a hacer un apoyo a esos negocios del gobierno federal, del gobierno estatal, realmente para reempezar la economía. Y yo creo que eso viene. Pero hoy en día hay que preocuparse más a la persona que el dólar. Y si no entendieron bien, quédense en su casa. Eso más que nada. No hay si tiene que salir a buscar una comida, si la bodega va a estar abierta, los supermercados van a estar abiertos, necesita ayuda médica, sí, eso sí. Pero si no tiene que buscar nada en la calle, no vaya a la calle. And just again, if you missed it throughout this whole conversation, stay home. If you don't need to get anything, you don't need to buy anything, just stay home. And reintroduce yourself to the people in your life. It'll be fun. Stay home. Because honest to God, that's the number way we're going to beat this. Thank you so much. And again, if you have any questions, 211 cityoflawrence.com, wearelawrence.org, and we're going to get through this. Thank you.
Thanks, everyone.